Good morning, everyone, and welcome to the Registry Partners CTR Coding Break Live. This is going to be a quick 15-minute webinar, and I have the pleasure of introducing our speaker today, who's Trisha Fordham, and she's going to be talking about the breast SSDI, ER/PR, percent positive, and range. So, Trisha, without further ado, feel free to take the reins.
All right. Thanks, Courtney, for that introduction, and welcome everybody. So during today's presentation, I'm going to be speaking about breast SSDI, ER/PR percent positive or range. ER and PR percent positive or range is the percentage of cells staining ER or PR positive by IHC. And SSDI has been collecting this since 2018. The objective of today's discussion is to discuss receptors, talk a little bit about breast ER/PR percent positive or range, and look at some codes and examples. So what are receptors? Receptors are proteins that attach to certain substances in the blood, and some breast cancer cells have receptors that attach to estrogen and or progesterone. Cancers with positive receptors are called hormone-responsive cancers, and the ER/PR test look for receptors that attach to the hormones estrogen and progesterone in sample breast cancer tissue. What is ER/PR positive or range? Estrogen and progesterone percent positive or range is the percent of cells staining estrogen or progesterone receptor positive by IHC. The cancer cells that depend on the estrogen make many estrogen receptors, progesterone receptors, or both. These receptors grab onto hormones that float freely in your blood and use them as fuel to help the cancer grow. The actual ER/PR percent takes priority over the range codes. And if the ER/PR is positive, but the percentage is unknown, then you would code that as XX7. So did you know that patients whose carcinomas have higher levels of ER/PR percent positive have improved survival when treated with anti-estrogen hormonal therapy drugs? Some of the anti-estrogen hormonal therapy drugs, for example, would be tamoxifen, anastrozole, and letrozole, to name a few. The number of positive cells can be reported as a percentage or within discrete categories. Intensity, this refers to degree of nuclear positivity, i.e. pale to dark. The intensity can be affected by the amount of protein present, as well as the antibody used in the antigen retrieval system. In most cancers, there is heterogeneous immunoreactivity with pale to darkly positive cells present. Here we see an example of IHC findings in the percent range. So starting with 0%, there's no cells that are staining positive. 10%, you just have a few staining, 20%, even more. And as you get up the percentage ladder, you can see that there's more and more cells that are staining positive. So ranges for codes in this data item are defined as depths of 10, which correspond to the CAP protocol. If a range in a report is given in steps other than those provided in the R codes, code to the range that contains the lowest number of the range in the report if the range is less than or equal to 10. If the range is greater than 10, then code to unknown XX9. The CRSA version 3.0 contains a new note, which is note 5, and it states if the range is greater than 10, then code to unknown. The update was overlooked for version 3.0 of the SSDI manual, and that will be included in the 2024 updates. So let's look at a few case examples. Here we're looking at ER/PR that's greater than or less than. So you have an ER or PR that's greater than 90%, then you would code that as 091. The next example, the ER or PR is less than 90%, then you would code that as 089. If the ER or PR is greater than 95%, code is 096. And if it's less than 95%, code is 094. The next examples are coding a range greater than steps of 10. So here we have an example of 10 to 25% and 67 to 100%. These two would be coded as XX9. In the first example, the report indicates 10 to 25%, and that percentage spans over 3 different range fields, which would be R10, R20, and R30. Therefore, we would code as XX9. And then in the second example, the percentage spans over 4 different range fields. So what about rounding? ER and PR percent positive do not have decimal points in the data items. Anything with a decimal point will have to be rounded. So if the digit after the decimal point is 0 to 4, you would round down. And if the digit is between 5 and 9, you would round up. SSDIs follow the definitions for rounding. So we have an example here. ER was positive. It was 93.5%. Because that decimal point is 0.5, then you would round up and code is 094. In the second example, it's 9.2, so you would round down and code is 009. Some additional thoughts. If you have a single tumor with multiple biopsies and a surgical resection with different ER/PR results, you want to use the highest, positive versus negative. Multiple tumors coded as a single primary with different ER/PR results. Code the results from the largest tumor size determined clinically or pathologically. And if all you have is information taken from your physician progress notes, then you can code that information. You just want to make sure and document that in your text. So this concludes the November CTR Coding Break. Please let me know if you have any questions. Here's my references for this presentation. If you have any questions, don't hesitate to reach out. And thank you for joining us today.
Thank you so much, Tricia. I don't see any questions, so I hope everyone just has a great weekend.